And one of the techniques that I feel is very, very easy for me to perform is the utilization of the CTI membranes, the CTI mesh that we have here with NeoBiotech, because it allows me to use the apron, the hole, to secure these membranes very easily to the implants if they're already placed. This can be done the day of implant placement, or it can be done after the implant's already placed. Here I utilized two mesh next to one another, secured them with a cover screw, and then placed bone and a bioactive material, the PRGF. I folded the mesh down. That maintains space. It's stable to the top of the implant. I can build out the contour. I can bring back bone all the way to the top of the implant. And the only negative with using it with other implants is that simply I don't have the advantage of being able to use the spacer. So it really works better with a NeoBiotech implant as opposed to having to use it on other implant systems. So here's the day of surgery. The meshes are secured. I always place fibrin over the top. And you can see here as an additive protection for the membrane and for the bone graft. We then suture over the top of the fibrin. We get tension-free closure. These are nylon sutures, 5/0, and the flaps are closed and released. This is now approximately 5 months. We come back, we've maintained closure over the area. We come back and you can see the amount of bone regeneration. Look at how the bone, you can see through the holes of the mesh. So on re-entry, when I pull the membranes, the CTI membranes away, you can see that we've been able to establish tremendous amount of bone volume in front of the implants. Here's my periosseal elevator leaning up against this material. We have a pseudo-membrane, the shiny material is very typical. We used to see it with Gore-Tex. When we removed Gore-Tex, the first ½ millimeter seems to be this amorphous pseudo-membrane-like outer layer of bone. But certainly, again, we want to augment further, so we're going to add more soft tissue over the top to gain height and density. This is the before and after. You can see how much bone was actually added to those implants, both vertically and horizontally. Additional soft tissue grafting was performed to give ourselves more height and healthy tissue for the future restoration of this area. So really the opportunity to grow bone even around an area of failure where bone has been resorbed and tissue has been resorbed, we combine the CTI membranes, GBR, with soft tissue augmentation to re-establish proper contour and health to the ridge prior to restoration. So really the process seems to work quite well. We can use this and we can extend the ridge form. I think it's a very interesting material, and I share with you a case where I used it with the NeoBiotech implant. And again, here's the video where I will use it the way it really was intended to be used, I believe, at the time of implant placement as opposed to after we lose bone. We're going to release our flaps. I'm going to advance this a little bit further into the surgery. And we're going to see that we have a very concave, which is very typical. And we're going to go ahead and I'm going to place a NeoBiotech implant into this ridge, knowing that I have a type 2 defect, a horizontal deficiency in the ridge. So my expectations are that I'm going to have some dehiscence of the implant, a fenestration through the labial wall of the implant site. I go ahead through the drilling procedures with the dedicated drills for the NeoBiotech system. And as I said before, it's best to use the CTI. Although you can use it with other systems, the spacers don't seem to work as well. So I prefer, if you're going to use it, really doing it in this manner is how it was originally intended. We have the stopper that makes sure that we go to the appropriate depth. And as I get to the final implant diameter, I start to see that I'm fenestrating the bone on the labial. So I have a dehiscence. I use the crestal drill to open up the crest for the final implant placement. And once I prepare the crest, I can then insert the implant to the appropriate depth, seating it completely. So that's the countersink drill, and then the implant being inserted. As the implant is inserted, one of the things I do feel from the system that you're going to hear the next lecture of Dr. Ho is that excellent initial stability that I get with this implant that allows for early and often immediate loading. You'll see that some of the bone now has been pushed through the labial. I'm going to go through the process. This is the angulation, giving myself an idea for the future of where that abutment is going to be. I use a bioactive modifier from the blood, again, the PRGF. And then I can insert the spacer onto the implant. Again, this is something that's unique for the system. And over the top of the spacer, we can then place the CTI membrane. Now what's nice is that they have improved the cover screw for the CTI. I give Dr. Ho a lot of credit because this was not very easy to use, the old system. The new one has a hex to place that cover screw, which makes things much easier. And now I can augment the defect on the day of implant placement. And obviously, you secure your membrane utilizing your implant and your spacer and your cover screw, and I can fold it over just as I did previously, and here is the fibrin material being added over the top of the mesh, completely covering it. I find when I do this, I get excellent healing. I prevent early exposure or dehiscence of the flap with the mesh, which is a complication obviously we would like to avoid. And then we can then go ahead and utilize a coronally advanced flap to cover this area completely. So this is really, to me, how it's been intended to be utilized, utilizing that material. Placing the implant, a deficient ridge, placing the implant, utilizing the spacer, the cover screw, and as I said before, now a much better delivery system of the cover screw to secure the CTI onto the spacer is now available. So this can be done quite quickly. We place our mesh, we place our Neobiotech implant, and then one of the nice things when you use the spacer is that when you remove the cover screw, you can pull the mesh right through a minimal exposure, very, very limited second stage surgery. Minimal access is required. And now you can see placing the healing abutment with an atraumatic, minimally invasive approach. The preoperative view, the postoperative view, you can see the bone having healed over the implant, very, very nice healing and expanding of that ridge utilizing this technique.